Hello, Dr. Ferguson coming to you from the Passioncam. Hope everybody's doing well. This is going to be the next part in my hormone series. I'm talking about natural hormone therapy and addressing some of the hormone issues that both men and women may face. So today I think I'll start off talking about excessive testosterone. I ended the last session talking about that. I'm going to talk a little more about that. Excessive testosterone in women can lead to a certain pattern. And that pattern would be truncal obesity, so large belly, a male pattern of balding, so balding in the forehead area and a balding in the occipital area, a deepening of the voice, and facial hair. All of those suggest that there is an excess of testosterone. And when you have an excess of testosterone, that means you probably have a deficiency in something else. Now, as I've told you in some of the earlier programs, progesterone is the building block of all of your hormones. And if one is in excess, that means that there's another one that's probably in deficit. When that happens, a lot of times what happens when a person's depressed, the cortisol will take the progesterone as a building block in preference to the others, and so the cortisol may get what it needs so that you can help in that fight or flight type of situation, in that stress situation, that depressed situation. But in the midst of that, all the others may have a deficiency in what they need. So what does that do? It leads to a hormone imbalance. And what are we talking about? We're talking about hormone balancing. So the lady that has all of those things I just described, that means your hormones are out of balance, and there is treatment for that. And what do? We have to bring the hormones in balance. So what I generally like to do is I first like to start with saliva testing. And then what I do, I get the results of the saliva test back. Excuse me. I get the results of the saliva test back, and then I just treat accordingly, depending on what's deficient, what's elevated, what's not, and we go from there in trying to bring that picture under better control. And when we bring that picture under better control, we do get a decrease in the facial hair, decrease in the truncal obesity. We may have a stabilization of the hair loss pattern, but the deepening of the voice part, that usually doesn't change. So unfortunately, ladies, you may be stuck with that part, but we have help for the other parts. So don't be too discouraged, because there are things we can do, and I encourage you to keep listening so that we can go over some of those things and give you some direction on how you can bring some hormone balancing into your life and maybe a loved one that you know, because this is an important concept, and it's many times not that difficult to bring a hormone balance into play. It's just a matter of knowing what to do. So on that note, this is Dr. Ferguson coming to you from the Passioncam. Be blessed and have a wonderful day. Bye-bye.